Hello guys, happy Monday. Welcome back to another episode. I'm going to keep this intro pretty short and sweet because I do have finals this week. It's Sunday afternoon before this episode is going up, and this episode is another guest with Dr. Rob. He talks about AEGD programs and GPR programs, which are general dentistry residencies if you're not familiar. So we talk about the difference between the two, how he likes his program that he just finished, and just kind of the logistics of them because I know personally I'd never really knew exactly how they worked. And then also we talk about LGBTQ health, and he does a lot of different webinars for dentists around the country. That way they can become more aware of terminology to use and different things that they should be thinking about to make their patients feel more comfortable and included and trusting of their care. So quickly before we do get into that main episode with him, I did just want to give you some life updates and share some motivation like usual. So last week you heard that I was about to take my tooth ID exam. At first, we got the scores back and I did not pass it. I missed it by one question. But then upon their reviewing of the exam, they realized that 2 questions were mismarked, and those were 2 that I happened to get marked incorrect. So I got 2 points back, and then I did end up passing. So that is all fine and dandy, very exciting. Still obviously not a high score, but it was very, very challenging, and I'll go into more detail on the tooth ID exams in our next episode when I talk about finals week, because we have another final tooth ID exam. But aside from that, I had a final this past week for histology that went pretty well. I passed. It was a pass-fail class, so no matter what you got on the exam didn't particularly matter as long as you passed, but I did score pretty high, so I was proud of myself on that. And then we also had an online final that you could take as many times as you want, open note, for our Intro to the Profession class, so I got that one done. And then we had a group project, a case study for oral facial function that I had to complete that was about pain, and there was you had to take these chief concerns of this patient and figure out 3 possible diagnoses and treatments for that pain. So that was kind of cool, and it was a group project, so it was a nice way to interact with some of my classmates. And then aside from that, I also finished all the quizzes for our evidence-based dentistry class, which means that I have finished 4 of our 7 classes for the summer. And then going into this week, our technical finals week, I have 5 finals. So I have a final in biomaterials, 2 finals in dental anatomy, and 2 finals in head and neck anatomy. So next week, you're going to hear an update all about how finals went and reflecting on my first semester of dental school, my D1 summer term, so look forward to that. And my little life hack or tip for getting motivated this week, what I've been doing is actually using music. So I made a little finals week playlist on my Spotify with some really random throwback happy songs, some We're All in This Together, High School Musical, Shake It Off, Taylor Swift, super basic classic songs that just kind of boost your mood and get you going through this tough time of finals or whatever you have coming up, whether you're taking DAT or if you're just enjoying summer. Why not make a nice summer playlist to get you motivated for whether it's eating healthy, working out, studying, reading, learning, whatever you're doing. I recommend that you make a fun playlist and kind of have some good vibes going into your week. So that's everything I have to give you this week in the intro, and now we will come back to the conversation with Dr. Rob in just a few seconds. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. All right. Hello, everyone. So we're back with another guest today. I'm super excited to introduce Dr. Rob, and I'll let him tell you all a little bit about himself.
Hello, everybody. So my name is Dr. Rob. I graduated from Loma Linda University School of Dentistry back in 2019. And I did my MPH before that in 2015. And now I'm wrapping up my AEGD this coming Friday. So And then after that, I'm going to be moving down to San Diego. So a lot of changes in the next couple of days, but it's exciting. And that's just a little tidbit about me.
Awesome. Thank you so much. So expanding a little bit about the MPH part of your education first. So what kind of brought you to pursue an MPH, and how do you plan to kind of intertwine that with your career as a dentist?
So I think one of the biggest things that I think just generally in healthcare, we kind of ignore public health, unfortunately. In medicine and even in dentistry, we really focus on treatment, but we don't really focus too much on prevention at times. And public health kind of gave me a good overview of what healthcare really is. And it kind of provided a support or a structure that I can kind of put dentistry in and just utilize some of the infrastructure that public health kind of gives you to kind of give you a better idea of what healthcare really means. So I guess I decided to pursue public health because one, I was actually really interested in it. And then another thing is I wanted to also be able to do some health education. So in public health, we have a couple different disciplines. You could go into like epidemiology, nutrition. I specialized in health education. So my program really was tailored to creating programs and creating content for various different subjects. And I kind of now am using that in dentistry when I talk to patients and that type of thing.
Awesome. So where did you complete your MPH at? Was it also at Loma Linda, or was that separate?
Yeah, so it was also in Loma Linda. Okay. So it was a really quick 1-year degree that I did before dental school.
That's awesome. So were you planning that, but from undergrad, you were like, I'm going to get my MPH, then I'm going to like apply to dental school, or was it kind of a different journey?
It was a different journey.
Okay.
I would say that I originally had the intention to go into medicine first.
Okay.
Come to find out that medicine just wasn't the right cut for me. So I withdrew from medical school, did my MPH for that time being in between. Regardless, I wanted to get my MPH anyways, and then fell in love with dentistry and have never looked back since.
Wow, that's so awesome. So I'm definitely curious a little bit more about your story then. So you were an undergrad, can you take us through your thought process about like choosing your career and everything, and how everything went with your journey of then ending on dentistry?
Yeah. So interestingly enough, I was actually interested in dentistry when I was in seventh grade. And that love kind of fell off. I was like, oh, I don't want to be looking at the mouth all day. It's kind of boring. So went to high school, went through college. And in college, I was like, you know what? Medicine is right for me. So started doing a little bit of research and doing a lot of other things at different institutions and trying to building up that resume. And I thought medicine was the right way to go, pursue my MD. And interesting enough, the school that I went to, a lot of my friends were also pursuing an MD degree as well. So everybody was pre-med in college. So I kind of jumped on that bandwagon, and come to find out after going through it, I realized, it just wasn't the right fit for me. I actually really like talking to people. I like to create that relationship. And dentistry was that perfect blend of medicine and interpersonal relationships. And you also find out that like, it's also easier for you because rather than going into the hospital all day long, you kind of tailor your schedule too. So there's a lot of pros to dentistry. My brother's a family medicine resident, so I could kind of joke about medicine, but I just think, dentistry is just the beautiful blend of the two.
Awesome. Thank you for kind of giving a little bit of your journey to get where you are today. So you mentioned you're in an AEGD program. Would you be able to explain to listeners what an AEGD is and talk a little bit about your experience in your program?
So an AEGD is, it's called Advanced Education in General Dentistry. I think a lot of people tend to get confused, probably by the third and fourth year, people are a little bit confused of what the difference between a GPR and an AEGD. And they're both 1-year degrees. You can do another 2-year program, but most of them are 1 year, and GPRs tend to focus on more hospital-based work. So it's more with chronic conditions. This is a very generalized overview. But and an AEGD is more private practice setting. So usually it's in community clinics and stuff. So it gives you more experience than what you would get in dental school. So for example, you would have a certain minimum requirement that you have to fulfill in dental school, but an AEGD gives you that kind of that push because now you're a doctor, you're a dentist, and they require you to perform at a higher level. So in dental school, you would probably see maybe 2 patients a day. In an AEGD program, you would see probably anywhere between 10 to 16 patients a day. And you make the calls on everything. So it's also nice too, because it provides a safety net as well for you. So these programs, it allows you to test your limit, but you also have the safety net of your faculty to kind of guide you. So I pursued it just because I wanted to get more experience and to just be more confident, clinically confident when I go out into the real world.
So do you think, like, if you're a 3rd or 4th year dental student and you're working on patients, what's a good way to, like, questions to ask yourself if an AEGD program would be right for you upon graduation or versus going into right into practicing?
So I'm a little biased. I think everybody should actually go into an AEG or a GPR.
Mm-hmm.
I only say that because dental school really gives you, it barely scratches the surface. And an AEG and a GPR is only going to give you more of that real world dentistry. In dental school, you're going to learn what's ideal, and what you want to strive for. But in real world dentistry, sometimes ideal, you can't reach ideal. So, it teaches you how to live with, I guess, patient management as well. That's another thing as well, where in dental school, you kind of had that cushion per se, but in AEGD, you're in charge of your, at least in my program, I was in charge of my patients and stuff. So having that connection, building those trusts, and, having good patient management skills, that's a big skill to have. And that's something you probably won't learn too much in dental school.
So I have a couple more questions about AEGD programs, because these are just things I'm curious about. Since I'm just starting dental school, I really don't know that much about them. So the first thing I was wondering, what's the process like of applying to these programs? Is it like a match system, kind of like medical school residencies or dental specialties? How does that work?
Yeah. So it's exactly what you just said. So what you would fill out first is the PASS application. And the PASS application, you would put your CV, your grades, your board scores, and your personal statement. All of that will come into a PASS. And then you would select the schools that you want to interview at. So for myself, I selected 10 schools in California. And then from there, I waited patiently to hear back from the schools that would give me an interview. As soon as I did those interviews, then you would go into the match system, and I would rank the schools that I got an interview, rank them 1, 2, 3, or however many you got an interview. And then I believe I got matched at the end of February. It's like a random computer algorithm, and they match you to the program that best suits you.
Awesome. Well, congratulations, by the way. I know you're finishing up your program, but congrats on being accepted and finishing. That's so exciting. So another question about that. I know in dental school, a lot of people pay for their tuition with loans. Once you're in this residency program, are you in loan deferment if you choose to be, or do you have to start paying on your loans during this residency?
So I think there's 2 ways that you could approach this. There are a couple people that approach it with a loan deferment. I think there is one that residents can do, I believe. Don't quote me on it. But what I decided to do was, because my residency actually pays me, I just acted like I was paying my loans back. So I would, say that I'm making, X amount of dollars, and then Fed loan or whatever loan agency that you're working with, they will kind of determine based on your income, how much you would pay. And, you'll start paying off of that. So for me, my income was super low that they just said, you know what, you're not going to be paying anything this first year. So I paid $0, but I still kind of acted like I was paying.
Okay. Yeah, that's great.
Yeah.
That makes a lot of sense. Also, you mentioned that the programs you apply through different schools, you said, and then is it the schools are affiliated with different community clinics and that's where you're practicing at?
Right. So with AEGDs and GPR, so most GPRs are hospital based. So you'll probably see a lot of them at the VA hospitals. But AEGDs, there are certain schools that have AEGDs. So there's one at like University of Pacific. There's a couple other ones at various, school institutions. And then NYU Langone is the other one that I'm part of, where NYU Langone has, gosh, I forgot, a couple hundred sites all over the United States. And what they do is they contract with these sites and they provide the structure for an AEGD program. So, they have programs all over all 50 states, plus a couple international ones, Puerto Rico and Trinidad, I believe, and a couple other ones too.
Oh, that's really cool. Yeah. I think my mind was thinking it had to be in the state of the dental school, but it sounds like it's a much bigger process than that. That's interesting. And I was just going to ask, did they tell you which, obviously you were placed with the NYU, and then did they tell you which clinic you were going to, or did you kind of have a selection of a few?
So you could select it. So in the pass application, what they'll tell you is it's an NYU Langone program. And then they'll just say it's located in, UCSF, or it's located in San Jose, or it's located in, wherever it may be. It'll tell you specifically, but it'll tell you what it's affiliated with on the pass application.
Okay. Awesome. That definitely covers all of my curiosities, at least. And if people have any more, I'm going to have your Instagram page in the description of this podcast if they want to reach out to you. But another thing that I wanted to talk about today with you, because you're very passionate about it, is LGBT health. And I wanted you to just kind of talk to the listeners a little bit about that.
Yeah. So LGBT health, gosh, this is such a big thing, especially in June. It's Pride Month. Mm-hmm. And this is something that, unfortunately, I think a lot of schools don't talk about. And I saw that in the lack of education that I had when I was in Loma Linda. And because it's just, there's no, formal education that's out there, right? So what I decided to do, at least when I was at Loma Linda, I decided to just create my own content and lecture it at schools. So I lectured this. I was fortunate enough to lecture it a couple years at Loma Linda. I've done the lectures at other schools as well. And it's just a population that's super vulnerable. It's a marginalized population. And unfortunately, a lot of people in that community have a hard time accessing care. And, we need to be, as healthcare providers, I think it's very important for us to be knowledgeable about all the various populations and communities that we serve. And that's one thing that we need to be knowledgeable about, is the terminology, knowing how to properly ask questions. For me, I really focus a lot on my transgender brothers and sisters. How do we navigate those type of conversations? What kind of things that we should look out for in the oral cavity when they come in, when they're on, hormone replacement therapies or whatever it may be. These are things that we need to be educated about, but that's something that I think is lacking in dental school curriculum. And I'm hoping that eventually, maybe a couple of years down the road, hopefully that changes.
Is that something that you think dentists can be like advocating for at like a political level, like to be like making changes in like the ADA with like curriculums for dental schools, or like how would you like to see changes implemented, like some steps that people could take or to be supporting?
I mean, we talk about, so many different things in dental school. I think this is something that we can, advocate for and really try to have some kind of formal education that all schools could teach on. I think this is, it really comes down, and this is where I think the blend of public health and blend of dentistry come into it, because, public health is very much more community. We look at community-based type of things. So that's where I kind of blend the two in, is with this whole LGBT health. So I think, it could be politicized and, advocated upon. And I think it's something that, we really should push for if we want to be a more well-rounded, competent provider.
Yeah, I agree. Do you have any resources or anything that you recommend the listeners kind of look at, anything to read, any pages or things to follow so that they can try to be more educated while it's still not included in curriculum?
Yeah, I mean, I think go online, couple good websites. They have a lot of good websites out there from various, big LGBT institutions that talk about different terminologies. Be familiar with the terminologies. And also like reach out to people that, that you like. For myself, I usually tell people like, if you have any questions, and I told people this on at the clinic floor when I was there, and I tell people on Instagram as well, like, if you have questions about it, like ask. I'm part of the LGBT community. So, if I don't know something, I always know somebody who I can ask that information for. So I think it's websites. There's so many websites out there that can really help in educating you on just how to, dialogue and have those conversations with this population.
Awesome. Thank you. Is there anything else you want to mention about that topic? Because I do have a few more questions just about like dentistry in general, but if there's anything else you want to tell people.
At the end of the day, everybody wants to be seen and everybody wants to be heard. And, in dentistry, sometimes we tend to be very closed off in that sense, where we kind of just look at the mouth and we just kind of do our, cavity preps or our crowns, and then that's it, but having that communication and talking to, people from that community and building those bonds and trust, like it goes so far. I'm a big advocate for it, of course. And when I see people that are from that community, I consider them part of my family, and I mean, anybody who walks in my door, I consider them family. But, there's that special thing about, them that sometimes it's hard for them to find people who are competent in that, in that field. So sometimes they get very scared to disclose that information, but I want them to feel comfortable. I want them to be, be who they are and be authentic with me. And that only helps with my treatment planning, but and it also helps in like whole person care. So that's kind of like my little tidbit.
Thank you so much. Yeah, I really appreciate you talking about this. And I could not agree more that as care providers, like it's part of your commitment is to be providing like the best care and equal care to everyone. And that does require extra effort on our parts to fully like understand people and treat them, like you said, like make them feel included and like comfortable and everything. So thank you so much for
I agree.
Talking about that today. I really do appreciate it. But
go ahead. One more thing. One thing I usually tell people is, and this is something that you'll learn, you will learn how to do great cavity preps. You will learn how to do a great class 2 prep. You'll learn how to do great crowns. But at the end of the day, what your patient's always going to remember is how you made them feel.
Mm-hmm.
So it doesn't matter if you do great dentistry. Okay. Because no patient is going to know, oh, this is a beautiful prep, or, oh, that's a beautiful whatever. But what they'll always remember is how you made them feel in that chair, because that's what really matters.
Thank you so much. I feel like I know I'm inspired listening to you talk. So hopefully the listeners as well are inspired to go out and do more and just try to better themselves and improve themselves in that regard. But so transitioning topics a little bit back to dental school specifically, I was hoping you could talk a little bit more about your experience at your dental school, why you chose Loma Linda for your dental education, and how your experience was overall.
My dental school experience. I would tell you this. My first year was definitely a challenge. Just because of the curriculum load, the load, you're just not aware of it, right? You're coming out of college. You expect a certain level of rigor, when it comes to studying. And then all of a sudden dental school hits and you're like, oh my gosh. So I'll be honest, I was like failing classes a lot first year. But also, to be honest, it was also a struggle too, because as a gay provider or a gay, individual, I felt that I couldn't be authentic at school. And that was a very big thing for me because, Loma Linda is a Christian university. And, I wanted to be real. I wanted to be authentic, but that was always holding me back. And it wasn't until the second year when our president for Loma Linda came out with this beautiful statement. And he pretty much said, I embrace anybody who's within the LGBT community. And at that point, it was like this green light that went off my head. And I felt part of the family now. And after that, then like everything just turn beautiful. And I absolutely love Loma Linda. Loma Linda is such a great institution, and I could have not asked for a better dental school experience. First year was rough, but second year came along, third year came along, fourth year came along, and man, they pushed me, it made me grow, and I could have not asked for a better dental experience. It's one of the best experiences in my life.
I'm really glad that things turned around for you, but that is so like heartbreaking to hear that you couldn't feel comfortable where you were at first. So that's just more reason that I really hope and will try to be a part of like change in all of like dental culture, but specifically at dental schools. So can you talk a little bit about your favorite part now that you are graduated and working on patients full time? What's like your favorite part of being a dentist?
Oh my gosh, the favorite part of being a dentist. There's so many to pick from. There's so many to pick from. I think like today, one of the, there's going to be good days and bad days, mind you, but like today I saw a 2-year-old baby girl, and, children, I don't really like kids. I'll be honest with you. I really don't, but this 2-year-old made my day, because as soon as I walked in and I said, honey, I'm going to be brushing your teeth, she just started clapping and being so happy. So it's those little things that you like cling on to, and it's just beautiful because you get to impact people at so many different parts of their life. A 2-year-old, I had a 2-year-old today, but I also had a 99-year-old patient when I was doing my residency too. So the beauty of it is like, you get to hear their stories, and you get to see, and you get to hear what they've experienced. And I think that's the beauty of dentistry is, the dentistry part is important, and that's, my livelihood, but being able to just connect with people and being able to just listen to their stories, and, it's just a beautiful thing that I personally just love, just to hear what people have to say and where they've come from and what their experiences were like in life.
Yeah, I'm so excited to have my first patient one day, and then every day actually be working on patients. I have a while to go, but I feel like it'll be here sooner than I realize. So I'm definitely looking forward to that feeling.
Blink of an eye.
So kind of on the other end of that, what is the biggest challenge that you feel like you've kind of dealt with as a dentist?
Biggest challenge. Why? I think one of the biggest challenges is, and I think you did a podcast on this, was comparing yourself with other people.
Yes, definitely.
I think that is still kind of ingrained in me, because I think in college, even in high school, but in college, you were kind of forced to try to stand out, right? And then you come into dental school and you have this very shocking reality that, whoa, everybody is just like me, right? They all study hard, they all got good grades. And then you come out of dental school, and then you're like, looking at Instagram, and you're like, wow, they're doing beautiful work here, beautiful work there. And it's hard because I think sometimes it gets really easy to just be like, oh man, like, look at them, look at where I am at. But I think we have to always remember that, each of us are on a different journey, and sometimes you just have to let time, kind of help you process things. And if you strive for perfection, that's good, because you will get there eventually. Right. But it's just being able to just remember that, everybody's on a different journey, and not comparing yourself with other people.
Yeah, I couldn't agree more. I think that's like the true testament that in a way never goes away, but I think you get better at dealing with it as you like mature and everything. Mm-hmm. So one of my favorite questions to ask my guests, because everyone has such a different answer, is how do you think dentistry fits into your overall life goals? What are some things you're kind of looking forward to in your life, dental or not, but how do you think dentistry is going to play a part in that?
Oh my gosh, what a packed question.
I know. Yeah. Take your time, peel back the layers.
My goodness. I've never been asked this question before.
It's long ahead.
fit in my life goals?
Yeah, I think it's important, just the fact that, yes, people are dentists, but they're people first. Dentistry is like your livelihood, but it's not all that you are, obviously. So I like to kind of see how people take that.
Yeah. Wow. I mean, for me, I hate to say this, but I love dentistry, and it's become a part of me that I can't really give up.
Yeah, of course.
And that's something that, you know, like I will always do it. And I wouldn't mind dying with a handpiece in my hand, you know?
Yeah.
But I think really it's just being able to give back. And dentistry kind of allows me to do that, in both, maybe in a financial way, but also in a skills way as well. Giving back to people. I'm looking back, in my college years, I did a couple mission trips out in Cambodia, and I did the dental part of it too. And just seeing the impact that it had on people that just don't have that access to care, and just being able to just provide them something so simple has such a lasting impact. And I think that's really where my heart is, yeah, dentistry is great. And, people think you can make all this money and stuff, but there's no point of accumulating all that wealth or anything like that if you can't give back to those who really need it. So I think for me is just having that capacity and being privileged to have the skill, to serve those who most need it. And I think that's kind of my life goal, or my life.
My Wi-Fi cut off the little bit of your last sentence.
Oh, okay. No, I was just saying, being able to just give back to those that, that just can't give anything, and that's the beauty of dentistry, is that, yeah, you could accumulate wealth from dentistry, but also we're given the talent of a skill set as well. So being able to use that skill set to help those in need is even better.
Yeah, I couldn't agree more. Do you see yourself working in a community health clinic long-term, or like part-time, or in a private practice setting, but seeing like disadvantaged patients? Like, how do you hope to kind of do that? I know you don't really know for sure yet, but.
Yeah, I mean, right now it's kind of just trying to find a job. That's my ultimate goal after graduating. But yeah, I mean, I would love to eventually just do a blend of, both private practice and community work as well. One thing that I'm looking forward to as soon as I get down to San Diego is, connecting with people from UCSD. They do have a free clinic that they do with a couple of the college students at UCSD. So being part of that would be something that I'm going to be looking into and hopefully join, because, we could do so much for just our local community as well. So, yeah, a blend of the two for sure.
Awesome. That's super admirable. So we're wrapping up here, but do you have any closing thoughts or advice you want to get out to the listeners?
Closing thoughts and advice. Well, I think for dental students, one thing I would have to say is take advantage of the time that you're there. I know you could get bogged down with a lot of the schoolwork and a lot of the kind of the craziness of things, but really take advantage of it. You're paying good money for it. So, learn from them. Like, one thing that I highly recommend third years and fourth years, even if you're not on clinic, go to clinic, learn. You're paying for it. So, if it means that you have to go in and shadow an oral surgeon or shadow a periodontist, or, all these different things, like, learn those things now while you're in school. Don't get caught up with, oh, I just did the minimum requirement, I'm good. Like, take advantage of it, because those are the best, quote unquote, CEs that you're ever going to get, in my opinion, while you're in dental school. So take advantage of the faculty that you're there, that are there, learn from them, learn from their mistakes, learn from what, their successes as well. And just kind of blend all that together so that when you graduate, you have a good base in dentistry.
All right. Thank you so much for everything today. I feel like it was an awesome episode. What is the best way for people to reach out to you if they have any more questions or anything like that?
Yeah. So any of you are welcome to hit me up on Instagram. My Instagram handle is dr.rjmfrey. I guess you'll put that on the link below.
Yes, I will.
But yeah, feel free to reach out to me there. And yeah, I check it daily. So if you have any questions in regards to LGBT health or AEGD programs or even dental school, feel free to reach out.
Awesome. Thank you
for
so
everybody.
much.
No, thank you so much for having me.
All right, so that is the end of this episode. I'm going to get back to studying for finals, but I will talk to you guys next week to recap how those finals went and reflect on everything I learned through D1 summer. Thank you for listening, and I'll talk to you on Monday.